now we can talk about who attends therapy. You see, so there's this misconception that you have to be ill to come for therapy, and I think that's slowly changing now in today's day and age.
Therapy is for mad people.
Yes, for the mentally ill. You see, for people who are suffering from severe disorders or things like that, you know. And I think that's a very negative stigma associated with therapy, so to speak. Whereas in reality, therapy is actually for everybody, you know, so to speak. Like even just for someone who's trying to understand themselves better, you could go for therapy and work through this with a therapist, you know, someone who wants to sort of also create meaningful connections in their lives. Because a lot of the times we've grown up and we think we know how to connect with people, but then you begin to realize that you actually don't know how to connect with people, and that causes a sort of a disturbance or a disconnect in your life, you know. The other type of client that does look or seek therapy, someone who wants to improve their day-to-day functionality, you know, someone who wants to sort of like do better, be better, you know. I have this saying that I like to sort of say, the only person you should be competing with is yourself.
Sure.
You know, the only person that you should be comparing yourself with is yourself, you know.
Exactly.
So we sort of help you do that in a sort of structured, non-judgmental perspective, you know. Also, another type of person that might be seeking therapy is someone who sort of needs help processing events in their life. And we as therapists sort of help bridge that. You know, we sort of help people come to terms with their situations, and so that they can function better in a day-to-day life. Are they eating well? Are they sleeping well? Are they getting their day-to-day tasks accomplished? You know, so our team can sort of like assist with that as well. And of course, the final kind of client that comes to us is people who are suffering from mental illnesses. However, it's important to remember that that's not all that therapy is. It's not just for people suffering from severe mental disorders. In fact, it is recommended that if you are struggling in your life, you should go and see a therapist so that it doesn't become a disorder.
Sure.
You see? So when you nip it in the bud, when it's still a little issue, so, you know, and it's not so overwhelming, that becomes, it's a preventative measure for, as compared to treating a disorder after it's already existing, you know?